Alright, we are taking out number 1, 17, and 32. Open big, honey. Okay, so first I'm gonna test and see if you are numb. When I press here, does anything feel sharp? Do you feel any sharpness at all? Good. Open big, 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 big. Alright, you're gonna feel lots of pressure here, okay, honey? Now you gotta resist me as I'm applying the force to you. No pain? Okay, open a little more for me. Okay, now there goes tooth number 1. Just making sure nothing is left in there. No. Open big. Turn a little towards me, honey. Now open wide. Let me get number 15, please. Okay, first I'm gonna test to see if you're numb. You're gonna touch here. Does anything feel sharp? Open a little wider and tilt your chin down for me. Just an envelope flap. Keep suctioning. How we doing? Still okay? Good. Now I'm just raising this flap here. Just making sure I don't tear the tissue too much. Okay. Keep suctioning. Still doing okay? Good. Keep suctioning. You always want to make sure you can see all the tooth. Hold it back with the Minnesota. Okay. Okay, lots of water coming in. Turn it a little towards me, thank you. Okay, I'm going to start troughing from the buccal to the medial and buccal to the distal. You're still doing okay, honey? Good. You always want to make sure the trough is deep but narrow. See, I continue the trough to the distal a little. How are we doing? Still no pain? Okay. Keep suctioning for me. Okay, at this point, I start elevation a little. She feels some pressure. The teeth is moving, that's a great sign. Just hold steady for me, honey. Lots of pressure, okay? It's always best to elevate in different directions. Nice and gentle. Okay, here we go, the tooth is out. Irrigation. Nice and clean. Okay. Open a little bigger, retract. Okay, now retract a little less, honey. There we go. Okay, so this is a gut suture. It's my favorite suture. Dissolve on its own. A single interrupted suture will do. Okay. Where's the irrigation? Right here. Let me irrigate some more here. Keep it nice and clean. Open just a little more, honey. There you go. Let me get 2 gauze, please. Okay, as you can see, it's nice and close. It's gonna heal really nicely. Let me get the bite block, please. Okay, open a little more, honey. There we go. Now on to the last one. Use the Minnesota over here. Thank you. And then where did we put number 15? Thank you. Okay, so 32, you can't even see it because it's under the gum. Same thing on this side. Honey, do you feel sharp here at all? Good, so I start here next to 30. I continue the incision. Okay. Right straight on the retromolar pad section right there so I can see. And I just connect the lines here. Then periosteal elevator. Gently trying to separate the tissue. Keep suctioning. Again, I'm gonna make sure I don't tear the other tissue, especially this papilla here. Keep suctioning. Turn a little towards me, honey. Turn towards me. Keep suctioning. So there is the tooth. Keep suctioning. Like I said, I'm gonna try to expose it as much as I can so I can see the whole thing. Some tissue covering it. Keep suctioning. So then I'm gonna start troughing buccally, very gently exposing the tooth. How are we doing, honey? Good. Again, buccally, easily. Okay, get me periosteal. Hold on to this, pass me that, thank you. Now I can see it really good, there you go. Troughing some more. Again, you want your trough to be narrow but deep. Okay. Mesially. As you can see, this tooth is tucked under tooth number 31. So this one won't be as easy as the other side. So I'm going to section it right down the middle. Are you feeling discomfort? Mm-hmm. Okay, so always raise your left hand. Pass me the anesthetic with septo. So she's had the block at this point, so I'll just put some anesthetic right next to the tooth. And then I let it sit for a minute. Okay, suction. Alright, now raise your left hand if you still feel discomfort, okay? Is it a little better? Mm-hmm. Good. So then I section it all the way. Now again I check and see how far I am. This is the end of the tooth. I'll just go a little further than that. You don't want to pass that line so you don't damage the lingual nerve. I'll take it all the way to the furcation. Alright, you're gonna hear a cracking sound. Bear with me. So at this point, I split the tooth in half. I'm going to remove the distal portion of it. So here comes the distal of the crown. So that's out. Now I'm going to elevate the mesial. There you have it. Now suction in there. I'll make sure I didn't leave anything. No, nice and clean. Let me get the irrigation. You're still doing okay? Mm-hmm. Very good. You come out for a second. Okay, let me get some more irrigation, please. You want to irrigate really good because you don't want to have any pieces of the bone left in there. Okay. Okay, breathe through your nose for me. Take deep breath through your nose. Hold on. Better? Okay, honey. Let me have the suture, please. Just by looking at it, because of the way the flap approximates, I know it's gonna heal really good. Okay. Suction for her really good. Keep deep breath through the nose, please. Deep breath through the nose. You're doing really good. We're almost done, okay? 30 more seconds. Okay, suction for her. Turn towards me, honey. Keep the suction for her. Okay, turn towards me some more. Okay, let me get 2 more gauze. Open, honey. Now suction back there for her. Again, I'll check, make sure I didn't leave anything in there. Open wide. Okay, bite down. Very good.